Miriam. I
Amazing.
didn't even notice.
Miriam.
I love that.
Miriam is committed. Okay. Are we
Hold
going
on.
live? Are we live?
I
Okay.
mean, I said we're going live, but I have to, you have to look over on the LinkedIn to make sure it's going live. So it's tricky, tricky,
Woo. Very exciting.
tricky, tricky,
Okay,
tricky.
let's see. Are we actually live? It should be better. We are very close to getting 150 followers, which is necessary so that we can go live directly, I guess, or something like that from the page. I don't know how to do math, but probably that.
Yeah, that is
So
correct.
that's
Okay, all right. It looks like we're officially live, so all is well. All right, so we got a bunch of special guests going on. We have some special correspondence that we sent to the health conference, y'all. We have a very legit speaker who is going to recap a presentation. On that later. We have like a really legit conspiracy that I first heard about at the Health Tech Nerds Bagel meetup, but it turns out Carrie Pycoach, our conspiracy collector, has been tracing this for like a year. So we're going to go into that. And then we've got some other things going on, maybe. But Lisa, to start out, I thought we would start talking about health. And I made this graphic, AKA my sister, Max, made this graphic to show everybody. This is how I felt about health right
This
here.
is a real picture.
This
This is like a photograph. This is what happened.
yeah, yeah. So this is what my experience of health was like. How was yours? Tell us about how you experienced the health conference, which was a total bender.
Yeah, I mean, it was a lot of parties for sure. I did meet some great people in person, but yes, this is a pretty accurate representation of what actually happened. I will say at the last party, I was drinking what is called a suero, which is like a rehydration drink for adults, like Pedialyte for adults. So not drinking alcohol, but just drinking the rehydration. Other people were mixing the rehydration drink with alcohol, which is a little bit complicated, but does happen. It's kind of like a mixer, kind of canceling out the effect. I all I can say is I hope everybody gets some water because there was a lot of what you see in this picture happening in real life.
Yeah, and real flames and eagles. So I
Real
went
flame.
to exactly 3 sessions. These conferences for me are business things, right? So I usually have back-to-back meetings most of the day, and then you got to do a bunch of things at night. But I went to 3 sessions. So one of them I've been thinking about since Sunday. It was my first session. That's what we're going to have Miriam on here in a minute. The other one I went to that was pretty good. It wasn't even really a session, but we went to at least, oh no, Nadine went with me. You weren't there, Lisa. We went to Stefan Kanya's Cancer X kickoff, which like was pretty
Yeah.
legit. Like, you know how I feel about like consensus-based leadership? Like not great. So I was like,
Which is
like
like
these
what is like
coalitions.
what a, by the way, that's like what I do, what my organization does, and Cat's like, not great, don't like the
I mean,
consensus.
why have consensus-based leadership when you can just be in charge? But it did seem like it seemed pretty legit. Like they have quite a few companies signed on, and like it might work. Like that's interesting to me. So
Yeah.
cheers to that. Other exciting
You
things.
got to meet our friend Sarah Hollebeck from Luminary
Oh my
Labs, who
gosh.
was also
Oh my
speaking of
gosh.
like Cancer X innovation challenges. Amazing. She held an interesting person dinner, which is also one of your favorite things.
I know. At first, I was a little bit like,
Who is
I was
this
a little upset. I was a little upset.
competitor?
I was like, who is this girl who has competitive, interesting person dinners? But I feel like we have complimentary, interesting person dinners, and she
Oh
can
yeah.
always come to
Oh
mine.
yeah.
So it's no big deal. It's no big deal. But yeah, yeah. So, I mean, I don't know. Should we switch off to our actual correspondents who can tell us about all the legit things that happened? I think yes. All right.
You
All
can
right.
go
So,
for it.
oh,
Party
yeah,
time.
yeah, yeah. Here they are. Here they are. Okay. So we've got, well, you guys are going to introduce yourselves, but I do. So, Nadine, everybody knows Nadine. She's like super famous. But Paul, no one knows Paul. No one knows who he is. But I will say Paul Wilder has been randomly just hanging out
Yeah.
with us for like 2 years, and he's the
He's
best. Like
ready to
he's
hang.
just like standing with his beer, and he just laughs at us. So Paul received a special assignment for health, and that was to also, like Nadine, find the good parties, give us the dirty dirt, and give us some legit like Fortune 500 CEO observations. So we'll start with Nadine,
Yeah. Yeah.
who is the most famous person in the room here, and
He
hear
is.
what she has to say.
He
So
is.
I took this task very seriously,
And
uh,
now you're paying for it.
and now I'm paying for it.
I have
I'm
to put on lipstick, Nadine. I don't like. Holy, you
Oh,
look really. Your lips look great. Yeah, yeah,
thank
yeah.
you. Yeah, still paying for it. I swear I got back from, y'all heard, I got back and slept for like 16 hours on Wednesday, and like I'm still recovering. But I've got a beer in my hand, really had to get myself in the mood here. But thinking about these parties at conferences, I've spent a lot of time thinking about the parties. Not only did we curate a like 100-line spreadsheet of all of the best parties.
You can pay her for access.
Yeah.
Yeah.
Yeah, we really gotta
Totally.
start making money off this. I'll think about that for Vive next year. But I put together a formula here actually. It
Oh
is
my God.
parties equal well, there's an N, which is the novel aspect, and then
Okay.
it's LFG. Some people might think of that as let's fucking go. But this is it's actually like it's a pretty solid
The
formula. and I think
party
it's
equation
expanding-
says, okay, location.
location. So it's location is the L. Then there's food and drinks, which is also like open bar and apps. Like you gotta have food. You have to have food. I think I ate like one meal this like you gotta have food. And then the G is good people. So you gotta have like you gotta have interesting people there, and you gotta get the numbers. So you really gotta hype it up. And then I added like an N as a variable. It's the novel aspect. And so like if any of these suck, like if your party is far, like it's got to be novel. Like there's got to be like a novel aspect.
Yeah.
Like,
Yeah.
the I will say like the photon party over at Area 15. Paul
Yeah.
and I. There was a little group of us trying to leave the sphere, trying to get over, and that novel aspect really got us over there. We're like, you know what? It's gonna be a really good venue.
It's worth it. It's worth it.
Photon guys are crazy too. Like that was
They-
wild.
I will tell you,
They're
I think they're
partiers.
like they're up there on like my favorite group of people that I hung out with this week. Very interesting. Like that party, a lot of weirdos, but I mean that in the best way possible. I had such a blast with that group. So the photon after party really, really hit the criteria for like a really good party.
Nice.
God.
Love
I
the
was up
formula.
there,
I really appreciate
Love
that
the formula.
innovation.
So it's P equals
N
N
times
LF.
times LFT.
Okay.
it's a really easy, like memorable, like let's effing go.
Yeah.
It's try to keep it.
Yeah.
I feel like
yeah.
Nadine is marketing this party formula already pretty well, so that's
Oh
also
my gosh.
exciting. I'm
Listen,
impressed.
Nadine, this is just an opportunity.
Two of the weirdos were me and Carrie. Two of the weirdos who were hanging around at Area 15. We'll talk about it later, I'm sure. Go ahead.
True.
I would say like
Oh my god.
hit a couple really good parties. Like the Zoo Salation party also met those criteria. Like location was really good, close. They had I love a good signature cocktail. That really gets me. That'll like get me to a party. Again, like really good people. Jonathan just obviously has this really contagious energy that you want to. That's like the one you want to be around.
Yeah.
And then we
As
also-
Lisa says, Jonathan Bush has fired by the board energy. It's big energy all the time.
He does. I think he would be fine if I said that, right? Because I'm sure he knows that. Like I probably
I just said it for you.
He
It's
probably has said it himself.
He knows that. Yeah, he would have said it himself. Like I'm not worried. I don't have any compunction about that. What does Paul think? Paul, where's your party report? Oh, Paul, we actually cannot hear you because your amazing mic is muted.
No.
Oh no, he had a fancy mic. Oh, I don't. That's not Paul.
Paul, you had this fancy ass mic.
Hey, Kat.
Oh, Miriam, we can hear you. You're not on the screen yet. Sorry.
We got him. All right, Paul. What the heck is what even happened?
What happened? Apparently some killer parties I didn't go to. Can you hear me now?
You're the party correspondent.
Yeah, we can hear you. We can hear you.
Okay,
yeah,
good.
Paul, you had like one job.
I thought I was supposed to just follow Nadine around, and I did that relatively well. I mean, actually, I think, I saw you. I was behind you at the Sphere thing. That was fun. That was a good location. You skipped the Sphere thing. I mean, it wasn't the best party.
I missed that. We missed it. It was just trying to like party. The Sphere was that was something else.
Mhm.
It was,
So,
yeah, Andrea.
so by the way, the Sphere, the big round thing, which also the fun thing, it has like a big movie that plays in there. I was about 2 rows behind Nadine, and you could see the movie starts. It's like this little format thing, and then it gets big. Like it goes from this, oh great, we're in this big sphere. It's going to be the size of a movie screen, to the whole sphere being filled, and she like nearly fell down the
Oh
stairs.
my,
She's like, "Oh my god, I'm getting vertigo. I gotta
I,
go."
I took a video and
It
you
was
can
quite fun.
hear me saying, like, I'm sitting next to Brendan Keeler. I like grab his shoulder. I was like, I don't know if I can do this.
It's great. Okay.
One of my friends texted me on Wednesday and said that he had to get taken out on a stretcher because he got vertigo from the Sphere. And apparently, according to the ER docs,
Oh,
it was
oh
not the
no.
first time, nor will
Yeah.
it be the last time. So it's like a pretty hazardous experience.
Oh no.
Brendan Keeler would like to know, Paul, how was the Hyperloop?
Oh, the Hyperloop.
Oh,
So
did
it's
you
How
take
was
the
the
not really
Hyperloop?
Hyperloop?
the
Did you take
Hyperloop.
the
There's
Vegas
just a
Loop?
bunch of, well, there's underground Teslas in a tube that go between different parts of the convention center. So you can fly, you kind of drive underneath and pop back up various places. It's like only a couple miles long. It doesn't go very many places. It's a little disconcerting. Like I swear, if you got into an accident, which shouldn't happen because they're like they have their cruise control thing going, I don't think you could open the door. I think the tube is like you're kind of stuck. So little bit interesting. But you do get places fast, and it's nice and smooth and all that happy stuff.
Well, that's
Supposedly being
exciting.
extended to the airport, which would be great.
Oh, that would be
That
great.
would be fun.
That would be great. All right.
Okay.
So, okay, you both of you, number one party, each of you.
Oh, I'd say the photon party.
Photon
Number
people are
one.
wild.
Really? I don't know. The
Really?
photon party was like almost so not pretentious it became pretentious. It was like, let's try really hard to pretend like we're cool and have like floating iridescent jellyfishes in the sky
Yeah.
with a Pandora tree with lights on it because
That
we're
was
that
amazing.
cool. Yeah. Versus,
It was so cool.
that's
That
not
wasn't
really
there. It wasn't theirs. That's just Area 15. The party was at Area 15. They didn't invent Area 15.
Yeah,
It's amazing.
they didn't make the jellyfish, Paul. That
But
was
they
the
chose it. They chose it. They chose where
They
to
did.
bring
All
this
right.
expensive conference set of people over to have some drinks and muckety muck. Anyway, it was
True.
fun.
All right. Wow,
But I
wow,
think
wow.
that
What
one
was your
was fun.
favorite?
Wait, Kat. I have my own favorite. You didn't ask me, but I'll tell you anyway. And that was the California Data Exchange Framework sort of like that was that what was it called, that Black Tap, a nice
Yeah.
location, very hot, very very hot. But the people were in good spirits. The food was pretty good, friendly, accessible. I think everybody who went was like, yeah, we had a good time. It was nice. Yeah.
That's right.
See,
It
P equals
made the
SLFG.
it worked in
People.
the formula. It worked in the
I did
formula.
like the
Absolutely.
photon
People.
party. It was fun.
Paul,
Good people.
Paul,
Good people.
what is your favorite party? You're just trashing
No,
on
no, I
the tree.
did legitimately enjoy the photon party, but I do have to point out that we were above our age grade for the location. But that's okay.
Oh
That's
yeah.
okay.
Oh, that's true.
And
Well,
from a location
I'm
perspective, yes, nice location when you got there, but like the advantage of like the Black Tap is I could kind of walk there from a hotel. There's it's Las Vegas. You can, stones throw away, you get a decent place to go. So
stalling. Are you
so
stalling because you don't know what
I'm
your
not
favorite party was?
no, I said the photon one. I said I liked it. I still think it was overly
Oh,
like
pretentious.
okay.
Yeah.
All right.
Everything
My
fits
favorite.
into Nadine's formula. Everything fits into Nadine's formula is what I have to say about this. It all works. Kat,
Yeah,
It
I'm
what's your
does.
favorite
downplaying the
one?
All
location a
Science.
little bit
does.
because I was okay taking the Uber ride to get there. It wasn't going to be that convenient. Anyway, good
I know.
formula though.
Yeah. No, so I had two favorite parties. One was Lisa's, so I have to come up with another one. I will say that party, the Blue Shield party, was great. Everybody was so fun and so nice. The only thing that was a bummer about that is that it was outside and it was real hot,
It was
and so I
hot.
drank like 90-degree wine. And then when I said, "Would you mind giving me some cold wine?" they poured a scoop of ice cubes into my plastic cup, which,
Nice.
listen, I'm in the
Hard to
South,
pass.
Hey,
y'all. Like, it was
that's
fine. It was fine. I
fine.
drank it.
That's fine.
And I did actually have a very good time at the WBL reception. So that was a
I
good time.
thought
There was some nice.
Oh, me too. That was a great
Oh,
one.
Paul wasn't invited to the women
Oh,
business leaders of the U.S.
yeah.
healthcare
What the heck
something
is that?
something. I don't know, Paul. Maybe next year you can be my +1. So,
I mean,
you
to
got to
be
be part of
clear, Commonwealth.
WBL.
I don't know. I
I'm
don't
the
know.
only male. Like I'm it. Every single person I've hired
You
since
know,
then has been female. Come on.
well,
Maybe
you know what?
Sounds like a
Listen.
diversity hire.
Yeah. All right, Paul. So tell us, you have the opportunity to tell us 3 legit observations from health. What could they be? Not parties.
One, Amazingly, if you went to health and did a survey, an employment survey, you would assume that one third of the country is a CEO already. About
True.
somehow,
Agree.
the data says like 37% of the
There
people
are
there
three
have a title
CEOs
as
on this
There
in
are
CEO.
this
three
block right
CEOs
now.
right here.
I understand, but to be clear, people, I mean,
You
some
can't
of
all
these
be
were
CEOs.
Yeah, we
some
can't
of their
all be
companies were
CEOs.
no bigger than the deli next door to my house. Like he has a 20-year plan, is going to retire and be fine. There's no revenue. Anybody can. My daughter is apparently a CEO now. Like, we'll just let her do
Yeah.
that. There's not just an
Yep.
owner,
Yeah,
Yep.
founder, like working it hard,
Yep.
guru. Just go straight CEO because the title
Right.
looks great.
that's
So
right.
anyway,
That's right.
he's
I
You
worth
know,
Fortune
I think
500
agreed.
CEOs.
titles matter,
Great.
Paul.
Apparently. Although, but everybody calls him that. Doesn't it kind of now get to minimize? I'm just saying it's no longer, you got to think of a better title than that. Super CEO, CEO of CEOs. Like, it's got to go
If
up.
everyone's elite, nobody's elite. That's why, you know,
That's
Delta's
right.
screwing us all
Correct.
over.
That's why being a diamond medallion is basically worthless. Agree. Okay, we can talk about that later.
Delta
Yeah,
is
but okay.
fixing that aggressively. They've apologized. But they're still going to screw y'all. It's okay.
Yeah,
That's right.
yeah, I saw that.
Yeah.
I'm ready for it. All right, what are the other two? What are the other two?
Two, I think there was a lot of AI, but a lot less than I expected. I actually expected to see
Uh,
that everywhere. And I would say you couldn't go down an aisle without someone talking about it, but it wasn't as much as hymns where like that's all I heard everywhere. There were people who were trying
yeah.
to do real
Yeah.
things,
Yeah.
which is good to see. Three, what I thought was interesting is the startups. I think they're a little more realistic than they were last year. I really felt like last year was a pound out, like crap show of partying and getting VCs and venture capital and PE firms to pay for all this drinks and whatever. The industry night last year was a crap show rave, right? It was bonker boo. And maybe Fat Joe isn't as popular as Ludacris, and so maybe the rave tones down a bit when you do that. But I felt like there was more realization that this is not a down round year, but it's a little more of a realistic year than last year. Money's not flowing as
Mm,
quickly.
Mhm.
You better
yeah.
think about what you're going to do next. You might want to figure out revenue and have a plan. Whereas last year, I think it was just just find money. Anybody's giving it out. It was a very different
I
vibe
feel
in
like
terms
it's a
of
down round
realization.
year, but yeah, but I think in general I agree with you, Paul. But that's also Luda. That was a whole different time. Whole
That
different
was a
time.
whole
Yeah,
different
yeah.
ballgame.
Mhm.
I'm going to add a
Well,
fourth thing just because
Oh,
am I allowed
all
to?
right, I'm ready. I'm ready for it.
yes.
Yeah,
Go
yeah,
for
yeah,
it.
yeah. I'm not gonna stop you.
I'm not sure. I'm sure you're ready. I was talking to someone. They said, I said, what is the thing? What is the theme? Like him's always kind of, you find a theme somewhere. And he's like, I don't know. I said, as far as I can tell, the theme here is let's try to make health more expensive, right? Because most of the
Paul,
solutions, well, no,
that's a
most of the
that's a
solutions were
banger. No,
additive.
I agree.
They were additive services. They weren't like how to get operational efficiency to be able to do more with less or do the same for less or better
Oh,
quality. It was you need to add these
Mhm.
wraparound services. And all those wraparound services, by the way, are great if you're building a business going to have revenue, so people are focusing on that. But it costs money to the healthcare ecosystem, and I'm not saying that's good or bad. It just was different. It was a different like
wow.
let's add services and get more out of healthcare versus trying to figure out how to make it better.
Is it like it's like
Yeah.
we gave up entirely on the premise that we might be able to save money on healthcare? Speaking of Blue Shield, Paul Markovich had a good piece today about that and the desperate need for anyone who cares at all about actually saving money and
Yeah.
reducing costs. Not even saving money, just reducing costs in healthcare. I mean, who cares? Hopefully someone. But I think that's those are very astute insights, Paul. I am very impressed. You were paying
Well,
attention. You may have
that's
gone to one more session than I did.
I know
kind
I
of
went to probably 10 less than you did, but I talked to a lot of people.
Sure,
that's
fair enough,
important.
fair
That's
enough.
important. I talk to people, but mostly about doing business. So, it's good.
Yeah,
It's good.
yeah,
We
yeah.
appreciate your service as special correspondents. I think this has been highly insightful. And also, Paul, like you kind of set us up for our only truly legit speaker on the show.
I did not mean to.
Okay,
I know,
that's
but just
mean. Nadine is
but
truly legit. Nadine
no,
came up with a
no, no, no.
formula for
I
parties.
did
Okay,
math.
okay. You know what? You're
That's
right.
the
That
And
is
for
legit,
formula.
that,
people.
I
She
want to
brought
apologize,
calculus. She brought
Nadine.
calculus.
I'm gonna
I
have
want to
all the math
apologize.
nerds like harassing me on
Like
LinkedIn now for
algebra,
my
you guys.
garbage.
No,
No,
You
it's
she's
guys,
a
got
great
derivatives
math.
like
and
that's like It's not calculus. It's
We're going to
basic
talk
calc,
about
but no
how to
offense.
commercialize. We're going to commercialize your list, Nadine, and we're going to commercialize your formula,
Nice,
and it's not going to
nice.
be a problem. Okay. All right. You guys are out of here. Moving
Thank
on.
you,
Okay. So,
party
Bye.
correspondent. Party
okay.
correspondent.
All right. All right. All right. All right. Yeah. Thank you, party correspondent. Any of our loyal followers, please do comment of your best parties and your best sessions and all those things like that. That's great because as you heard,
Yeah.
I did not go to any of the sessions except for those 3. So, okay, our next special guest, our legit guest, is Miriam Paramore, who is not my mentor at all. She is not. But she's a very legit person. She's done 1 million things.
Yes.
She's been CEO of 12 companies and, all the things. And now she is an advisor to Goldman Sachs and Sixth Street. And she gave the first presentation of Sunday that I went to. Maybe there were more. I think she may have been one of the first to go. And she spoke
Me too.
about her father and how the end of his life went in rural North Carolina. And I've been thinking about it since she spoke. And she had shared this story with me previously, but hearing her talk about it on stage with Jeff Anderson, who is with Homeward, and Claudia Williams, who is we talk about often on our show. A luminary in our space, and hearing her talk about it made me think, like, holy shit, like all these shiny, crazy things throughout the hall, and Paul's point, all the CEOs in their garages, like none of it actually really matters if it doesn't actually impact the caregivers and then patients at the end. So I've been thinking about it a lot, been kind of depressed, but like I got to go drink hot wine at the Blue Shield party, so I'm not that depressed, but wanted to give Miriam an opportunity to tell us all about that experience and like what she plans to do next as a result. So we're going to change our screen so we've got some flying eagles here with some flames to set the scene. So welcome, Miriam.
Hi. Thank you so much for letting me be on here. Thank you, Kat and Lisa. And I actually I was trying to figure out how to chime in earlier because I had so much FOMO of what you guys were talking about.
Oh,
So-
you can talk about your favorite parties too. You should talk about your favorite parties also. We could we'll lighten the mood.
Like the first thing I wanted to say is, does anybody realize that today's Friday the 13th, which is just kind of
It is. Yeah.
And shout out to Nadine because I still have on my friendship bracelet that Kat gave me right before or after the talk on Sunday, which is a great idea. And this shirt, which I still don't know what anyone's trying to do. So it's very easy for me to believe they're not real since I don't know what they are. So, I'll happy about that. I'll tell you that my favorite presentation that I went to, which was an N of 1. So I went to exactly one presentation.
Oh, you went to the least of all. Fantastic.
But it was my favorite. It was called Medicaid Wants Innovation Too. And it had a really kind of like powerful panel, and it was a pretty diverse panel, different points of view. And the lady, Adaze, I believe is her first name, but she was on Obama's Let's Be Medical People board. And this guy, Andre, who sort of moderated the thing, was the chief medical officer.
Ostrovsky?
Yes.
Yeah,
was the chief officer for Medicaid at some point. And it was really interesting panel when they had a couple of founders on there who were doing something, I don't remember, but the conversation was about, nobody wants to invest in Medicaid centric like businesses because nobody can figure out how to make money sort of doing that. And Andre was being pretty provocative. He's clearly kind of on the progressive side of the world, but he was saying, can anybody deprioritize greed? Essentially, that's a paraphrase, but he was really
first of all, that sounds like Andre. I worked with him at CMS, and yes, that sounds like something he would say, and he is definitely out there fighting for sure.
Yeah, it was a really interesting panel, and I thought about it because I know y'all do a lot of work, with Medicaid. And there are ways to make money. I would just chime in to say I think the whole theme of the conference is to find money. That was the theme.
Find money. How to find money. Well, you guys saw the chart that I drew. This is how you find money. You walk into the venture capitalist place in their boardrooms and you just say, money. Money. That's what you do. That's what I learned.
That's right. My comment back to you is it looks like the revenue projections for everybody on the floor because that's everybody's pitch deck when it was live.
Yeah, what you can't see here is this actually is 0 way up here.
Yes.
So it's fine.
That was
Pre-product,
You've got to start the access
pre-revenue.
in the right place.
I agree about the WBL reception, and then I lament I have huge FOMO because I went to really not a lot of parties, and I didn't go to like any fun parties except for WBL, which I was late for. And I'd just like to put a note out there for Nadine on the spreadsheet, which is please don't have 2 receptions or parties at the same time that both have the word women in the name, because
Yes.
Women at Health and WBL was at the same time, and so I got
It
the name
sucked.
right and the locations wrong, and I went to the wrong place, which led to me busting into the double doors that were black. That the security guard said it's in there somewhere, and so I just busted through these black doors and went through the kitchen galley and ended up finding the thing I was supposed to be at dinner, but it was an hour and a half later. So
You
that
know
was
what, Miriam? You got the job done.
I did.
You made
So,
it.
Yeah.
You got the information you
Gotta get
needed,
there.
and you moved on. I like that. That is like
innovation at party going. But anyway, I love the show. I listened in on your first show when I was out hiking, so I couldn't see you guys. But I was really happy to be here today, even though my topic is serious. But so anyway, thank you guys, Lisa and Kat. I love the energy and I love the no prep. It's awesome. So
You're
yeah,
welcome.
no,
Anytime.
I really do. So I'll tell you a quick story about my father before I talk about it. So this necklace I have on, if you can kind of see it on the screen, for those of you who can't see, it's a sterling silver, and it's just an ampersand sign. So and so when I had a big birthday about 10 years ago, right after I'd had my life fall apart, which happens every 7 to 10 years, several things come together, and there's sort of a nervous breakdown, and there's one or two divorces, and something happens.
And sometimes
7-year cycle.
But my dad had this made for me. He was a very thoughtful man, and he was a great writer. He was a great speaker, and he had this made for me, and he gave it to me. And in the poem that he wrote for me, he said, "This is to remind you, and there is more." Because at that time, I thought I had lost, sort of everything that was important to me, and so it's really precious, and it's sort of a gift of his and kind of how he was as a person. And what I talked about on stage was in observing and being heavily involved in my dad's care for the last 3 years of his life, but really involved in his life, as much as I could be. I got to see up close really how bad our healthcare system is, especially for people that have chronic comorbidities. And I kind of raged about this a little bit on LinkedIn, but myself, I've been in this industry for over 30 years, and I say all these phrases too. I say population health and people with multiple comorbidities and dual eligibles. And I say all these words, and I'm immune to, I'm so desensitized to what it is that I'm saying. So when we all see it up front, and each of us have it, people on the call right now have parents that they're helping to take care of too. Dad's situation was he had heart failure, he had kidney failure, and he had melanoma. And the picture of him that's posted on the first LinkedIn that I wrote is he and I hanging out. He has a huge Band-Aid on his nose, but he had
like Lisa.
Right, except it was like right on the middle, like this huge thing, part of his nose had been cut out. So what was so tragic about the situation was the other thing he had to manage. So we have heart, kidney, we have sleep apnea, so we have a sort of difficulty breathing, and the machine's really necessary at night for him to breathe. I thought that he had died one time when he was staying at my house, because as I stuck my head through the door and count, it was like over a minute before he took a breath, and I thought, Lord, man. But I mean, really needed that machine to breathe at night. And then you have the melanoma that Dad was the son of a farmer, and he was an outside from the time he was 8 years old, and people didn't have sunscreen in the 30s and 40s. Nobody knew, and he was an avid fisherman and golfer, and like nobody knew use sunscreen. So so that was something that was really, really serious as well. And people, you kind of think about like skin, like what you had, Lisa. I've had a few of those things too, and we just kind of don't think that they are really that bad, but like melanoma is like really bad. So in his situation, he did have a primary care doctor that he trusted, but he also had a cardiologist, a neurologist, um, I guess a dermatologist, but whatever kind it is that becomes the surgeon that helps you with melanoma. So that, and then his primary care. So we have four different providers and four different points of care. And then when he went into dialysis towards the end of his life, that was a fifth location. So he was 87 years old when he passed in July and didn't even have a valid driver's license and was driving himself around in this, pickup truck. And, that's when I found out that Medicare Advantage, which hello Humana, and if anybody works for Humana or knows anyone who works for Humana, yeah, holler, because I was astounded that he never heard ever. Like, isn't managed Medicare supposed to have part of the managed part? Or did somebody just put that word in there? What does it even mean?
You would think given his complex conditions, that he'd have a case manager of some kind. You would assume.
That's what I thought. I thought a case manager or care coordinator, somebody. But
Yeah.
I thought that
managed just means utilization in this case, tragically, and it should not be allowed to just mean utilization. And it's ridiculous and absurd that somebody could be dealing with a serious condition near the end of their life, and they're just out there on their own, hoping that there's a caregiver who's going to put their uncompensated, untrained, obviously you're very skilled and experienced, but you're not trained to be managing someone's medical conditions. That's what it is. They just depend on caregivers and people themselves.
I heard in his house, his woman that he was married to, it was also ill and unable to care for him. And then I have a half sister who lives in the area who is a nurse. And so we had access to his Epic medical record. And, what the kind of the biggest 2 points I wanted to share about, kind of what happened with his suffering was that he had chronic degeneration and, musculoskeletal degeneration in his hip and knee. So he was on some painkillers and Celebrex-like things. And as the kidney disease progressed, they didn't want him to have those. So he gets titrated off of all pain medicine except for Tylenol twice a day. And he was in horrible pain. And that was allowed to continue while one entire year elapsed when the cardiologist and the nephrologist could not get on the same page. So he neither had the heart surgery he needed for a stent, nor did he get on dialysis, because the kidney doctor says your heart can't take dialysis, and the heart doctor says your kidney can't take this heart surgery. And because he went through 12 months of going from one doctor to the other, have a test, check your creatinine level, wait 3 weeks, go to the cardiologist and see if he thinks that number is okay. It's not. Go back to your primary care, get your primary care to tell you what the two doctors need. And this is what I mean when I just say lack of care coordination. And I've been really angry kind of about it, but as I was getting ready to be on that presentation panel, I thought, how can I be hopeful? That's really why I tagged Homeward. If you get somebody like Jeff, you get somebody like Jenny Snyder, who grew up in rural Michigan, who is a successful businesswoman, who is a doctor that starts a company and says, hey, rural health means something. So everything I said for Dad could have easily happened in an urban setting. It still would have sucked. It would have been absolutely horrible. But when you put rural on top of that, the distance just makes it a little harder. And there really there's no one in the fee-for-service environment who is incentivized for whole person care for my father, or someone, as I put it, to truly care for my father versus caring for his diseases and his organs. And so now I'm just confused, y'all. So I'll just end with a note of confusion, because I thought when we did managed care, and again, maybe these are all just phrases that don't mean anything, but I thought when we did managed care as an industry that we were trying to put value-based care sort of in the mix here so that we could find aligned financial incentives where that care coordination could happen. So no one from Humana ever contacted my father, ever. So, in terms of that outreach or, that case manager, that nurse or somebody that might help.
Maybe Miriam, they were thinking this guy's only taking Tylenol and that's it. That's all that's happening. So he's good. He's not costing us that much money, right?
I don't know. They're thinking since no one talked to him. I'll tell you this is, I mean, it's so complicated. The things I could go, we could have a like 6 month show about all the things I learned. But when he went into dialysis, his bill, because I would help him with his insurance, so I'd log into his Humana portal and all this stuff. He was spending about 25 the bill. Now again, these are fake numbers because nothing really means anything. But the top line on the EOB was $25,000, and then it's discount a month. Okay, but when he got on dialysis, it was $125,000. So the bill for the last 6 months of his life for $773,000 top line. Now then you come in with the Humana quote managed care discount, and that was like $750,000, which leaves you 23. Then there was some other weird discount that I've only been in the industry for nearly 4 decades, have no idea what that other discount was. And the net of my dad's responsibility was very little. So financially, this wasn't like financial disaster on top of everything else. But it's just when you get to be up close and personal to it, and then someone you love is suffering, that's the thing that's just so difficult. He was getting sicker and sicker and sicker. His life was getting worse and worse and worse. And no one took the data. As I said, I'm a data person, so I'm a huge believer in that technology should help us make some difference, at least data or information, not data, but information. No one had a conversation with each other, and certainly not with my father together, that said, look, you have these 2 diseases and they're going to progress, and we need to manage your pain. So what would you like to do? So that he could then make choices around, would you like to go ahead and do your heart? In a little bit of risk here. Let's get your kidney treated and postpone dialysis, if we can. But would you rather manage your pain so you can be more mobile? Because these other 2 things are going to progress anyway. So it was just a great example of everything you hope your parent doesn't go through, but did. And it is really complicated, and I think it's all about aligned incentives, which is the same thing we always say. So,
well, Miriam, it sounds like, like you just said, there's the technology and the data aspect of it, which should have been there. And then there are the services that should have been there, which is like the care coordination. But overall, there's like this broader lack of coordination, and just this total willingness to wildly spend money in your people's end of life. Just this whatever, put it on the unlimited credit card of the health system, and don't ask for 1 second what anybody wants or cares about or needs, like you just said, right? No conversation about what do you want to do? How can we make your life better right now? I think we all probably know that President Carter is in hospice right now, and made the decision to go into hospice now 9 months ago, having a great time, just turned 99, enjoying life, and being in a comfortable place. And that's an amazing, exceptional, totally not normal example. And then you have so many stories, unfortunately, like your father's, where no conversation, no coordination, nobody taking responsibility. Technology and data is available. Data are available. Technologies are available. And it's weirdly not being used. Why? It blows my mind. Truly.
No, but you're right. And that's exactly right. And that data piece, it's not that we don't have data. That's why I think like what Civitas does and what all of us have tried to do with health information exchanges, or whatever the hell this is, or whatever we're doing, whatever the
hell this is,
whatever's on fire, whatever, is let's be on fire now. Fire's my 4th, this is going to save the industry standard. But I do think the data is largely out there. Systems aren't shared, but I would love it if they would just plug into the North Carolina Health Information Exchange, or somebody look up this record, and then the rest of us, hunting around pulling stuff. But you've got a trained clinician and a trained healthcare data expert in me, trying to span a lot of distance and time. And it just, again, I think I would have hoped that the managed care kind of concept would have come in, because I thought that's why Medicare commercial went sort of privatized anyway, so that companies like Humana could run that. So I'm mystified about that, and I get that none of his doctors were incentivized to do anything other than they performed according to their incentives. They did exactly what they were supposed to do based on how they were incentivized. And I heard a lot of people talk about that at the conference, kind of to bring that back around. But I don't know. I think your other guest made a really good point that like just doing or having more employee benefits, like new family care. It's not maternal anymore, but family, help you have a baby. So,
Reproductive care, yeah, care and fertility was one of the big sponsors.
Just having more mental health or more, maternal / baby options, or the newest app on your phone. It's all additive. So how do we work together to bring it to a conversation with the patient? That's the deal, and make an informed choice. But somebody has to quarterback it. So can the doctors, like, I don't know, call each other and like, hey, we're gonna do the heart, it just,
You would think.
yeah,
Yeah.
yeah,
It's depressing. I mean, go ahead.
that's it. I was just saying, I would hope that somebody would pick up the phone and say, let's talk about Jack Paramore. Let's just talk about him. Let's not send him on this 1 year, 18-month, where he gets to drive around. And of course, when you're elderly, you totally confused, you don't feel good.
Right.
You're sick, you're totally confused. You don't really understand it. And he totally deferred to his primary care doctor, who did nothing but like traffic cop him to all these other specialists. And I'm like, man, no, not okay. So I do like some of the companies that are coming out in the senior care sector, I would say. And I don't have anybody to plug, really, other than Homeward, but I have met a few other venture-backed companies that are focused on either rural health or trying to get it to, sort of this senior sector, or, end of life care coordination, or, something like that. So I'm sure you guys are seeing that too.
I'll say all the things that you're are saying, like I said, it made me depressed because I'm over here like flinging around data, making data deals, thinking I'm saving America. And I was like, yeah, well, I guess it only matters if someone actually like looks at it, or the tools are there to use it and it's in workflow, and someone actually talk to a caregiver and talk to a patient, which doesn't always happen when we're making these charts, right? It's hard to actually talk to people who will use it. And it reminds me of there's the Jesse's Law. I think you may have heard of it. It's a Manchin-sponsored bill or law now, and it's named after a woman who was recovering from opioid use disorder, and she went in for ankle surgery, and her family and she did all the work to say, do not give me opioids, right? Do not do that. And she ended up, I believe it was a hospital in Ohio. And even though that information was in her record, she was prescribed opioids and overdosed and died, right? It's like, no one is actually like, unless people are actually going to look at it and use that information, then it's just a total load of bullshit. So I'm a little depressed about that. So thank you very much for this.
Well, I did not want to be the downer, but I so appreciate.
This is an important topic.
I so appreciate the chance to talk, and I love you guys, and it's so funny in it. But this is just, like I said, when I talked at Health, and Jana gave me the chance to do that with the Health Foundation, and shout out to the Impact Pavilion and what they're trying to do with the Health Foundation, the patient energy there, the patient centricity of that thing, that vibe was jumping the whole time, and really a lot of heart there. I think we're going to see that grow. I'm going to do everything I can to help her grow that piece.
Nice.
But it's just, the data infrastructure is there, the information is there, but someone has to love that person. Someone has to realize that this is a whole person. This is not a walking set of diseases. And you can put it on lists and you can put it on spreadsheets, and but I still do believe most people that are in healthcare choose to be in healthcare because they would like to actually help people, in some way. And it is frustrating when we don't see our efforts, pay off. But y'all are doing great stuff, and just keep it, keep doing what you're doing.
Unscripted. Well, I'll leave with two things. So you asked about cool companies working on this space. I met an amazing founder today, Helen from Care Academy. They are training sub-nurse caregivers to support home care and all that stuff. I thought she was so cool.
Nice.
We'll have her on the we'll have her on the show. And the other thing is, in your presentation, I think Claudia asked Jeff, who was a physician assistant working in rural Michigan, what he would have done with if your father was his patient. And I think he said
This is Homeward. Jeff is with Homeward. Yeah.
with Homeward, yeah. And he would have asked your father what he wanted.
Yeah.
Weird.
Yeah, exactly. Yeah. And, so we will, I hope we'll talk more. I hope I get to come back, and I'll be.
You'll come back.
Maybe a fun person trying to bring everybody down. But I just want to say thank, because I love my father so much, and to be able to share a little bit what a wonderful man he was, and maybe help somebody else. It matters a lot to me. So thank you.
Thank you, Miriam.
Thank you
so much for sharing with us. We really appreciate you, and thanks for bringing attention to this really important issue.
Thanks, guys.
Absolutely. All right, you guys. Now we're going to do a hard transition to ridiculousness.
Like a hard
turn over here. Carrie Pie Coach will be talking to us about a new conspiracy theory. So, like I said, I was with Nadine at the Health Tech Nerds Bagel place on Monday morning, and like someone was talking to me about this like CTO conspiracy, and I was like, oh, so weird. And I mentioned it to Carrie, and she confirmed that this is in fact a real thing, and she has been tracking it for over a year. So, and this is her tracking chart right here. So, Carrie, welcome back to the show.
Oh my God.
We would love to know what's going on here. Bring some clarity to the situation.
And okay, just a few things. So one, Miriam, thank you for sharing your story about your dad. As a policy and a human on this planet, I testified to Colorado legislators to get more funding for rural and for technology so that you can use this data to do good, but there's still so much work to be done. So Miriam, thank you for sharing. And I would love just to amplify your story. 2, love the shirt. QAns are not real. Love the energy there. And 3, conspiracy theories. I believe in science, democracy, voting, all the good things. And this is a great way for conspiracy for good. So please don't think I'm crazy.
Conspiracy for good.
So last
but you never know, right?
You do never know.
If you ever need me back to talk about something serious, happy to do so. But for like if you Google right now today, like conspiracy theories right now, there's some pretty high up political ones that may seem similar to this, but we opened the door and said, what conspiracy theories in health tech are going on? And it came up again and again that there's this, somebody is running HHS technology and there's no one in that seat. I've been trying to go through like, who is it? Where are they going? Obama in the US kind of White House side.
Wait, your conspiracy includes Obama? This is going to go off the rails. This is very bad.
It does. Well, let me back up. So there is a U.S. technology officer that was established in Obama's office. That is turned over. There is no one in that office currently, but if you figure out who that is, let me know.
Officially, there's no one in that office.
No one, but we are starting to believe that there is somebody unofficially in HHS.
That's what I'm saying. I'm saying.
So this crazy board, and I will show, I've added more to this. So if you peel back the onion, very bizarre. You go back to earlier this year, HIMSS was in Chicago. ASTO, area state territorial officials, was also in Chicago where QHINs surface. I was just the messenger. I didn't, how could I be so smart or Kat or others? Like we were just messenger. So it came up in Chicago. So that's kind of, you got the HIMSS on both sides. I'll just to channel Nadine, here is it in the flesh, but you can't see it all. So we'll just go kind of through that. So we're starting with Chicago, central theme there. As I went to various parties like Health Tech Nerds at Meow Wolf, as well as at the Bagel Breakfast, we're like, what are things going? It's got to be somebody Chicago centric, or there's strings attached to that. So as we dug deeper, there were like signs and hints that these individuals are do-gooders. They like policy, alignment with standards. So like fire standards. Sorry, Miriam. It's someone that is altruistic. And so as we gone through this, I did the thing that you probably should do. I went to get my tarot read
Smart.
at the
Mm,
Owl. And we went
mm.
into it, and it was the star card, the world card, and it came up the emperor and the empress. So as a world leader, somebody that's like a known star, and it could be male or female.
Ooh,
So in
Mm.
teasing
ooh.
this out, I thought for sure it had to be Jess Kahn and Tom Novak, former and current leaders of CMS, Hearts of Gold. But Tom's too into like cooking things and meats and collecting tumblers
Mm,
that he just doesn't have time, and Jess is
Not
too
into
busy.
overtime. Yeah.
Yeah,
not
Jess
into
is too
no
busy.
overtime, no unpaid overtime.
Mm.
Yeah, and
Yeah.
she's too busy saving the world through her work with Mackenzie. So that we ruled that out. And so digging it through deeper, we're like, oh my goodness, it has to either be Kim Kardashian or Anish Chopra, based on the Chicago ties and peeling it back, and based on, Kim and
Ooh,
her work
ooh.
in
Wait,
reform
is
for
your
criminal
Chicago
justice.
tie for Kim Kardashian like
Kanye
her
West.
daughter Chicago? Okay, and her ex-husband? Okay, I was like,
Oh.
what connection?
And for
Okay. Okay.
Anish,
Wow.
he was appointed by
Wow.
Obama, who's from Chicago, and
Oh, I
From
see. I
so
see. I
Chicago.
see. I
yeah,
see.
so
Oh my
there,
Okay.
goodness.
so
Okay.
lots of
So it's happening.
questions. Yeah, so I'm leaning towards, I think it's Anish Chopra. We had a hunch. We talked to some in the care journey space. They're like, yeah, I think he's doing this all for
Interesting.
the greater good. But I,
Are you
would love
saying,
to
wait, are
talk
you saying the shadow CTO of the US or HHS? Is that what you're implying here?
unofficial,
Can you get me
unofficial.
the
Yeah.
unofficial
So,
shadow?
so you guys,
Interesting.
sometimes I hear some whispers here and there, and I will say, it's hard to know because sometimes, we're
Mm,
drinking a little bit of the hot wine. But I've heard at least two different people tell me that Anish Chopra is in fact the shadow CTO.
interesting.
I've heard that.
Interesting.
I've heard that. I've heard that.
I will also say at Nadine's amazing Health Tech Nerds happy hour, there was a woman wearing a Kim Kardashian
Mm.
shirt and spent a lot of time
So
Oh,
trying
we don't
to
know.
turn the conversation
oh.
to say that
Mhm.
probably is Kim Kardashian. So
I'm
I
into it.
will open it up there. If you agree, disagree, let us know. Happy to dig in. And perhaps we have Kim Kardashian or Anish Chopra or
Kim
the
can show up to the
actual.
show. Yeah, they would both, all of them can show up to the show. We'll give them some space.
I think we should
Totally.
just cut to the chase and ask them about live on LinkedIn Live, what
Yeah,
what's
yeah,
going on here. I
yeah.
think Carrie, nicely done. I look forward to continuing to track this story. It seems very useful.
Kat, can you put up the chart again for a minute, Kat? Can you
Oh
just
yeah.
pop it back on the screen so we can take a good look at the spider chart?
Yep.
This is
It's right here.
amazing. I mean, this is really great work, Carrie. I am very impressed. I like how there are two options here, and one is Kim Kardashian. That's amazing. Love it.
This
Very
took a
Fantastic.
lot of concentration and may or may not have had support from other incentive members like Melissa Danino. She does deny plausible deniability, if that sounds crazy. So
Yeah, 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 yeah.
happy to be
Amazing.
Love it.
here. And again, thanks to Miriam for sharing her story, and Kat and Lisa, the hostesses with the mostest.
That's freaking
Thank
right.
you.
All right,
Thanks,
Carrie,
Carrie.
keep us updated. Looking
All
forward
right.
to progress. All right, on we
Love
go.
it.
So Lisa, we've got 7 minutes till the LinkedIn cuts us off. What do you want to talk about?
Well,
Your
I
face?
haven't yet explained why I have a thing on my face, but it
Oh,
is,
yeah.
in some extent related to the story that Miriam told. Obviously, not in any way, shape, or form the level of severity or importance, but had a little basal cell carcinoma under my eye, just a little dot. My very astute nurse practitioner noted it and sent me to a dermatologist who sent me to a surgeon, and I got a little bit sliced off just after health. So I went straight from all those parties right onto the operating table. It was very exciting. But all I can say, my PSA is under the Affordable Care Act, screenings, preventative screenings are at no cost to you. If you have insurance of any kind, you have no out-of-pocket costs, no copay, no deductible, no co-insurance. You just go every year, get your screening, and call it a day. Get an annual wellness visit every year. You get that for no cost sharing. And you also get a dermatology screening for skin cancer or things that are cancerous or precancerous. Totally worth it. Annoying to go every year and find a physician, but just do it. It's great. It was very easy. This was like very minimal. They found it really, really early. This shows you how not vain I am that I'll show up with my beautiful face marred. I was like, hey, don't make any money on my face, but if you can just be careful. And the doctor laughed, of course. But do that. It's definitely worth it. And, no more cancer, hopefully.
Get your mammies too.
Oh, wait a minute. I just thought of something else. Another connection to the conspiracy theory. Ready? Khloe Kardashian had melanoma on her face
Oh my goodness.
recently, and it was cut, and it was on the show. It was cut off, and she was like had a little tape thing on her face too. So there are lots of connections. We don't really know how this is going to go.
You know, it's
no
it's
idea.
coming up more Kardashian because Kim is very passionate about corrections reform, and it's one of our employees' passion projects. So, I think it's, is it a coincidence?
Okay.
I don't know.
Okay. Very,
I don't
very
know.
close. Wow.
No idea.
That's exciting.
No idea.
But yeah, I mean, I think other than that, Kat, I would just say that lots and lots of noise about the ridiculous cost of healthcare. We should probably yell about it more in a future talk show, because there are people who are doing things to reduce the cost and think people are doing things to increase the cost. And I'm not saying those people are PBMs, but I'm saying they're PBMs. You never know.
I met a guy I really like who runs a PBM though. So yeah. But yeah, no, I agree. I would say in general, PBMs may not be on the side of the light. Maybe not. Not sure.
Not so much.
Yeah.
Oh, speaking
yeah.
of PBMs, Walgreens rolled their CEO over, or got a new CEO who's a PBM guy, and they are unfortunately closing primary care clinics because of it, which is a little bit weird. I feel like we don't have enough primary care clinics, but I'm not sure if I'm making that up, but I feel like there's definitely not enough primary care doctors, clinicians, clinics access. So it's a weird choice to be like, we are shutting down primary care as a cost saving measure.
Agree. Especially since that was kind of the point of some of these early reforms, right? Just to push care back out to the more affordable point of care. Yeah, I don't know. It's super weird.
Yeah.
Who
weird
knows?
choices.
Who knows who's lobbying about what? So that's a thing. But there was also a lot of chitter chatter, Lisa, about creepy dudes at this conference.
Oh yeah, creepy dudes.
Yeah.
We're speaking specifically about the really wonderful post by Casey Langwith, who was brave enough to sort of write her experience down and call some people out and sort of make a point of it. Obviously, the history of this calling people out thing is not great in America, generally with the Me Too movement and the ups and downs and sideways of that. But I do think it's important to be able to mention that, hey, creepy, harassing, and worse behavior is not okay at a business conference or anywhere. And please don't do it. It's just very disheartening to see that time and time again. And it's important to be able to talk about it and also feel like you aren't on your own, because it's really, really tempting to say I shouldn't make waves, right? I shouldn't call someone out. I shouldn't just let it go away, kick it under the rug. But the problem is, if you have this happen so many times wherever you go, any business experience, that's terrible for you and your confidence and the work that you're doing, and nobody deserves that. So
I thought Casey. Yeah, I thought she was very brave. I thought that good for her, right? People in positions who can take hits, right? I mean, because that's unfortunately what happens. Retaliation is real. I thought that was awesome that she had the courage to do that. And props to her. I know lots of other women shared similar stories. And I would just like to say to the man who offered me $60,000 in stock options to become his sugar baby, to the man who took me in a taxi to his hotel when he was supposed to be taking me to the next party, to the man who grabbed my face so hard that my cheek bled because he tried to kiss me, to the man that walked me to my car in the rain away from the crowd with an umbrella and then pushed me against the car and groped me. I remember you.
Wow.
The end.
That's
It's tough.
I mean, again,
it's tough being a woman in business.
It really, it really is. And also I would just say that if you're tempted to say these were isolated incidences, I would say they're not. If you just ask a group of 5 women about their experiences being a woman in business, you're going to get stories as terrible as the ones that Kat just told you of things that actually happened to her. And, it is what it is. It's not isolated. These happen all the time.
Yeah, it's horrible, right? And things even like getting hit on at a party, at a conference, just shouldn't happen. And it's unfortunate that those things get so much worse. And again, props to Casey for starting the conversation, calling people out. I hope she does find that guy. I hope she does find him. Yeah.
Yeah,
So
exactly.
yeah, a common thing. It shouldn't happen. We shouldn't even have to talk about it. Like, it's freaking annoying that's even a topic of conversation. It's gropey and greedy, gross, nasty stuff. So
Yeah.
with that, I wish we had
ending
a
on
more
a fantastic
way.
note.
Yeah, let's put Carrie back up here with the Meow Wolf
Yeah.
Forest in the background to just say
Perfect.
thank you all for joining our talk show. You are the best. Thanks to our guests. Thanks to our special correspondents. Thanks to you, Lisa.
Thanks, Kat. See you everyone next week.